Let's just get some facts on the table to consider. So I know in the New York Times article you were talking 50 years ago, 34 weeks was premature, so premature that even the baby of the president could not be saved, at least at that time. So tell us where the borderlines are for you. I mean, how young is it possible to save a child? At what age do you think, what age of gestation do you think it's perhaps borderline? To what age do you think you should? And perhaps you could tell us a little bit about the associated risks with babies around this borderline area.
The borderline area keeps creeping down. And so when I started my residency many years ago, I was told I took care of a 26-week infant, my first day of internship, and the baby was very red and had very fragile skin and was very tiny. And I was told that baby's not going to survive. 26-week babies just don't survive. And the baby died a few days later. I also, and now a 26-week baby, we're okay with. They don't have a lot of the problems that the smaller babies have. At this point, we resuscitate 25-week infants routinely, and even 24 and 23-week infants we do resuscitate if the parents want us to. If we leave it to the parents' decision at 23 and 24 weeks. And this varies from hospital to hospital, but this is basically what is written according to the guidelines that we follow. So it is somewhat standard of care, but those specifics change according to the individual physician and the individual hospital. Once we get down to 22 weeks, most of the hospitals these days are discouraging parents from resuscitating a baby that small because of the high risk of death and also of severe, profound disability if they survive. On the other hand, I recently took care of a baby that was less than 22 weeks. Somebody else had resuscitated the baby, and the baby died after 2 weeks. It was very sad. The baby probably experienced a fair amount of pain through that 2 weeks, and yet the parents also had a chance to be with the baby and spend a little time getting to know her and saying goodbye.
Can you give us an idea of what proportion of babies suffer some damage and how serious that damage is? If you're talking about 23 weeks or 24 weeks, these areas that are currently gray areas for you?
It depends what statistics I use. So at 23, 24 weeks, over 50% of the children will survive, but 90% will have a severe to profound disability, according to some statistics. What severe and profound disability changes according to which papers you read. And so it really does, it's really hard to estimate. And so I try not to use estimates. I say there's a very high risk of profound or severe disability. But obviously, their disability is something that people live with and are happy to live with. The problem is for the parents to make that decision about what they consider a life worth living. And I think that's a very hard decision for parents to make because they probably don't really know.
One of the cases that we've read about was a case that occurred in Texas of a baby called Sydney Miller, who was born at 23 weeks, which, as you were saying, is very much in the grey area. And since this was a few years ago, I suppose it was even greyer then. And the parents said in advance, apparently, that they only wanted comfort care. They did not want aggressive treatment. But the hospital overruled them. And as a result, Sydney Miller is alive but has severe cerebral palsy and other problems, I understand. And the parents were rather angry at this and sued the hospital. So what's your view of this case? Or if you had cases like that, you think that it's justifiable to overrule a parent's wishes?
No, I think that in a case like that, where regardless of where we practice, especially back then, 23 weeks is never really considered to be outside of that gray zone of viability. And so I think to override a parent's wishes because of one's own values is really unfair to the baby. It takes the autonomy away from that infant, and especially an infant that has such a high likelihood of profound disability. And so I think that really is an unfortunate situation. I have seen other cases of that, and often it happens just as it happened with that 21 plus week baby that I took care of, that I have, people see a baby that's crying initially, and they think, oh, the baby's crying, this baby can fight, and I bet the baby will do well. But in fact, the state of an infant at birth does not reflect on how well they're going to do long term when they're that small. And there's been lots of studies that have shown that.
So the fact that the baby appears to be vigorous or is crying is not really an indication that there's not some severe damage, right? Yeah, okay. You also mentioned that different hospitals in the United States have different policies. Does that mean that it's to some extent a little bit arbitrary as to, if you go into one hospital and you have a very premature baby, your baby may be treated and may survive, although perhaps with a significant disability. And if you go into a different hospital, your baby may not be treated and may die. Is that a good situation, or do you think we should try to somehow have more standard policies?
Oh, that's a good question. I think to some degree we need more standardization, but I think also that the more we regulate medicine, the harder it's going to be to find people that really think that are doing that work. So I would say that we ought to be standardizing a lot. We do have evidence-based medicine now. I think all subspecialties are trying to move towards that. But sometimes we don't know. And one of the problems is exactly that. We don't have enough money for research in medicine, so we don't have the information. Technology is moving so quickly that we can't possibly keep up with it. So we have to do something. We have to feed a baby somehow. We don't know if we should feed the baby quickly or slowly, or start on day 1 or start on day 5. And so we try to do research and we try to get the best information, but a lot of times if we don't have the evidence, we have to do something. And I don't think it makes sense to say that we need to regulate things that aren't based on evidence.